Hi everyone and welcome to my channel Hube tabibi. This video of mine is about illness anxiety disorders, sometimes called hypochondriasis or health anxiety. Well, it is worrying excessively that you are or may become seriously ill. You may have no physical symptoms, or you may believe that normal body sensations or minor symptoms are signs of severe illness, even though a thorough medical exam does not reveal a serious medical condition. You may experience extreme anxiety that body sensations such as muscle twitching or fatigue are associated with a specific serious illness. This excessive anxiety, rather than the physical symptom itself, results in severe distress that can disrupt your life. Earlier on this channel, I have already uploaded a short video about illness anxiety disorder. I hope you have already seen that. And now I am going to discuss this illness in detail. Well, it's a long-term condition that can fluctuate in severity. It may increase with age or during times of stress, but psychological counseling and sometimes medication can help ease your worries. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by American Psychiatric Association, no longer includes hypochondriasis, also called hypochondria, as a diagnosis. Instead, people previously diagnosed with hypochondriasis may be diagnosed as having illness anxiety disorder, in which the focus of the fear and worry is an uncomfortable or unusual physical sensation, being an indication of a serious medical condition. On the other hand, somatic symptom disorder, a related disorder, involves focusing on the disabling nature of physical symptoms such as pain or dizziness without the worry that these symptoms represent a specific illness. Now I'll tell you the symptoms. Well, symptoms of illness anxiety disorder involve preoccupation with the idea that you are seriously ill, based on normal body sensations such as noisy stomach or minor signs such as a minor rash. Signs and symptoms may include being preoccupied with having or getting a serious disease or health condition, worrying that minor symptoms or body sensation mean you have a serious illness, being easily alarmed about your health status, finding little or no reassurance from doctor visits or negative test results, worrying excessively about a specific medical condition or your risk of developing a medical condition because it runs in your family, having so much distress about possible illnesses that it is hard for you to function, repeatedly checking your body for signs of illness or disease, frequently making medical appointments for reassurance or avoiding medical care for fear of being diagnosed with a serious illness, avoiding people, places, or activities for fear of health risks, constantly talking about your health and possible illness, frequently searching the internet for causes of symptoms or possible illnesses. Because symptoms can be related to health problems, it is important to be evaluated by your primary care provider if this has not already been done. If your provider believes that you may have illness anxiety disorder, he or she may refer you to a mental health professional. Significant health anxiety can cause real distress for the person, and reassurance is not always helpful. Sometimes providing reassurance can make things worse. This can be frustrating and cause stress on families and relationships. Encourage your loved one to consider a mental health referral to learn where to cope with illness anxiety disorder. Now I'll tell you the causes. The exact cause of illness anxiety disorder is not clear, but the factor which I'm going to tell you may play a role. Beliefs. You may have a difficult time tolerating uncertainty over uncomfortable or unusual body sensation. This could lead you to misinterpret that all body sensations are serious, so you search for evidence to confirm that you have a serious disease. Family. You may be more likely to have health anxiety if you had parents who worry too much about their own health or your health. Past experience. You may have had experience with serious illness in your childhood, so physical sensation may be frightening to you. Now I'll tell you the risk factors. Illness anxiety disorder usually begins in early or middle adulthood and may get worse with age. Often for older individuals, health-related anxiety may focus on the fear of losing their memory. Risk factor for illness anxiety disorder may include a time of major life stress, threat of a serious illness that turns out not to be serious, history of abuse as a child, a serious childhood illness, or a parent with a serious illness, personality traits such as having a tendency towards being a worrier, excessive health-related internet use. Now I'll tell you the complication. Well, illness anxiety disorder may be associated with relationships or family problems because excessive worrying can frustrate others. Work-related problems are excessive absences, problems functioning in daily life, possibly even resulting in disability, financial problem due to excessive healthcare visits and medical bills, having another medical health disorder such as somatic symptom disorder, other anxiety disorder, depression, or a personality disorder. Now I'll tell you some preventive measures. Well, little is known about how to prevent illness and anxiety disorder, but the suggestion which I'm going to tell you may help. These suggestions are, well, if you have problem with anxiety, seek professional advice as soon as possible to help stop symptoms from getting worse and impairing your quality of life. Learn to recognize when you are stressed and how this affects your body, and regularly practice stress management and relaxation techniques. Stick with your treatment plan to help prevent relapses or worsening of symptoms. Now I'll tell you about the diagnosis. Well, to determine a diagnosis, you will likely have a physical exam and any test your primary care provider recommends. Your provider can help determine if you have any medical condition that require treatment and set limits on lab testing, imaging, and referrals to specialists. Your primary care provider may also refer you to a mental health professional. He or she may conduct a psychological evaluation to talk about your symptoms, stressful situations, family history, fears or concerns, and ways that your anxiety is negatively affecting your life. Have you fill out a psychological self-assessment or questionnaire? Ask you about alcohol, drug, or other substance use. Determine whether your illness preoccupation is better explained by another mental disorder, such as somatic symptom disorder or generalized anxiety disorder. Now I'll tell you the treatment. The goal of treatment is to help you manage anxiety about your health and improve your ability to function in daily life. Psychotherapy, also called talk therapy, can be helpful for illness and anxiety disorder. Sometimes medication may be added. First, I'll talk about psychotherapy. Well, because physical sensation can be related to emotional distress and health anxiety, psychotherapy, particularly cognitive behavioral therapy, CBT, can be an effective treatment. CBT helps you learn skills to manage illness and anxiety disorder and find different ways to manage your worries other than excessive medical testing or avoidance of medical care. CBT can help you identify your fears and beliefs about having a serious medical disease, learn alternate ways to view your body sensation by working to change unhelpful thoughts, become more aware of how your worries affect you and your behavior, change the way you respond to your body sensation and symptom, learn skills to cope with and tolerate anxiety and stress, reduce avoidance of situation and activities due to physical sensation, reduce behaviors of frequently checking your body for signs of illness and repeatedly seeking reassurance. Improve daily functioning at home, at work, in relationship, and in social situations. Address other mental health disorders such as depression. Other therapies such as behavioral stress management and exposure therapy also may be helpful. Now I'll tell you about some medications. Antidepressants such as selective serotonin reuptake inhibitors may help treat illness and anxiety disorder. Medication to treat mood or anxiety disorder, if present, also may help. Talk with your doctor about medication options and the possible side effects and risks. Now I'll tell you about some lifestyle and home remedies. Well, in addition to professional treatment for illness and anxiety disorder, these self-care steps which I'm going to tell you can help. You should work with your provider, work with your primary care provider or mental health professional to determine a regular schedule for visits to discuss your concerns and build a trusting relationship. Discuss this setting reasonable limits on test, evaluation, and specialist referrals. Avoid seeking advice from multiple doctors or emergency room visits that can make your care harder to coordinate and may subject you to duplicate testing. Practice stress management and relaxation techniques. Learning stress management and relaxation methods such as progressive muscle relaxation may help reduce anxiety. Get physically active. A graduated activity program may have a calming effect on your mood, reduce your anxiety, and help improve your physical functioning. Participate in activities. Staying involved in your work as well as social and family activities can provide you with support. Avoid alcohol and recreational drugs. Substance use can make your care more difficult. Talk to your primary care provider if you need help quitting. Avoid searching the internet for possible diseases. The vast amount of health information that may or may not be related to your situation can cause confusion and anxiety. If you have symptoms that concern you, you should talk to your primary care provider at your next scheduled appointment. But this was my video about illness anxiety disorder or health anxiety. If you have any question about this, you can ask me in the comment section. Thanks for watching this video. See you in the next video. Bye for now.